Hello everyone, my name is Holden Hardman. Thank you so much for joining me for another video. Today I wanted to take a look at health insurance commercials and their attempts to try to be relatable to, just the average person. Now, I feel like I should have some full disclosure. In my opinion, health insurance companies are the most morally bankrupt company that exists. And I'm not just saying this as some sort of outsider. For those of you who don't know, I work in finance at a hospital. My specialty, my entire job, revolves around people that get admitted into the hospital and have no health insurance coverage. That's literally all I do. I used to work in the ER, so if you're like self-employed, you don't pay for health coverage, or you lost your job and all of a sudden you get into an accident, you get really sick, you get a sharp pain in your side, your chest starts hurting, you might be having a heart attack, and you have to come in. I used to deal with those accounts, but you know what? Those are low dollar accounts. Those are $5,000, $6,000. Not even worth my time. They bumped me up. I only see patients that are admitted into the hospital, so $30,000, $40,000, $50,000 accounts. And so a part of that involves me having to deal with insurance companies and seeing everything from the other side. A lot of people, they watch the news and they hear how things are going, but the actual practice of it, like if you don't have health insurance, you get admitted, I'll be coming to see you, if you're within my census anyway. And I don't want to get too political about this, so I'm not going to be like, vote for so-and-so, but this is like a very real problem. And I love the psychology of health insurance companies and how they're able to manipulate the public to make them think that they're on our side. Do me a favor, this is gonna be a little exercise at home. I'm gonna go get my wallet. I want you to get out your health insurance card. I'm gonna cover up my info on here. And I want you to take a look at it. And I want you to say to yourself, whatever insurance provider you have, these people do not care about me. They will do everything in their power to prevent paying for my medical bills. They will hire lawyers. They will find any legal loophole to not pay for my coverage. I just want you to do that, okay? And then I really need you to believe it, okay? Okay, we're gonna come back to that because it's very important. There's all types of language that are used in health insurance companies. One of them, and this is so freaking brilliant, they call themselves a healthcare provider. They don't provide to you. Your doctor does. The nurses do. The people that are actually taking care of you are providing for you. And the second thing is the word choice. That's a big one. You want to be able to choose. You need choice. What works best for you? You know, the only choice that people really care about is if you get sick or if you get hurt, you can get the coverage that you need and not go bankrupt. You have a specific doctor that you want to visit, you ought to be able to go to that doctor. That's all that people want. When they say choice, what they're talking about is in-network and out-of-network. It's bullcrap, ultimately. So if you have a specific doctor that you want, you have to go check to see if they're in network or if they're out of network. And I don't know who needs to hear this, but it's not just as simple as, oh, this hospital is in network, I'll go there and it'll be covered. Because sometimes they have to get specialists to go in and check on you. So you might go to a hospital that's in network and they'll bring in a doctor that's out of network. So you'll get a hospital bill and a physician's bill. One of them might be a network. It's a whole thing, guys. It is convoluted and it is specifically designed to oppress people and to keep them from seeking healthcare coverage. I get fired up about this. I feel the Holy Spirit in me today, guys. And with the coronavirus stuff going on, people are starting to freak out, especially people that are uninsured. And I know what some of you are thinking, because I saw that Donald Trump thing where he said, I talked to all the health insurance people and testing and treatment will be for free.
Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing.
And I thought for a second, wow, maybe there's some humanitarian stuff in there too after all. And then we got some clarity saying that this is not the case. Many insurers have said they will pick up the cost of coronavirus testing for some policyholders, but not the treatment. And saying a test or treatment is covered doesn't mean it's free. And then I had to remember what I said before. These people don't care about me and they will find any way to prevent themselves from having to pay for my bills. The most recent one that I saw, this was like a year ago, it was with Nick Jonas, because they're bringing in, likable celebrities to try and help. This one was Cigna.
How do you make time to take care of the basic things like going to see a doctor?
I do my best to get into for the basics. I'm also type 1 diabetic, so I was actually diagnosed 13 years ago today, actually.
Oh,
I was actually diagnosed a year ago today. Wow. Okay.
Now, diabetes at any age is a stressful diagnosis. How did you manage the stress part of it?
I find that vacations, or just time off in general. Even if you're not traveling, just being at home, resting is really important for me. And then also I linked up with a great doctor who was just fantastic and was really patient with me, finding out that answer you don't want to hear. And for me, having that traumatic experience, being told you're type 1 diabetic, my first question was, am I going to die?
Everything that Nick is talking about right now is all from between him and his doctor, which is great. That's what people should be doing. What does Cigna have to do with that? That they paid what they were supposed to?
You have a very conscious plan for managing stress. You feel comfortable talking with your doctor about stress? How do you raise the issue when you're in the doctor's office, for example?
They're so smart. God, they're so smart. See, I was talking to him about, your relationship between you and your doctor. Well, that's between you and your doctor, the one that's actually providing for you.
I'm really encouraged to see that there is no longer a taboo about talking to somebody. Whether that's a professional who can be there to listen and help you process your stress or whatever else is going on in your life, or friends and family, loved ones who care for you.
What does Cigna have to do? What does any health insurance company have to do with any of this? Everything he's saying is right. It's good that there's no more stigma about talking about if you're diabetic or mental health or whatever. But Cigna is they're just money people. They're the ones who, after that conversation, that deep heart-to-heart with your doctor, and the doctor says, hey, this person needs this treatment, Cigna is the one that goes, do they need this treatment? I don't know. Let's take a look. We're not going to cover that. Or worse, we're going to take about a month to decide. People like to talk about universal health care and these wait times. People die waiting for their insurance company to give the okay to move ahead with a specific surgery. Nobody really likes to talk about that, but it happens a lot.
Which urgent care do you want to try this time?
Oh, this one's only a mile away.
Ooh, and it's in network.
Yeah, this is gonna be awesome. Steve. I thought you were gonna land in the pool.
So close.
It's not always easy to control your enthusiasm, but with United Healthcare, it's easy to find quick care options and compare costs.
You hear that? It's easy to find quick care options.
Choosing a healthcare plan can be overwhelming, but it doesn't have to be when you work with a partner. Because Cigna not only offers valuable benefits and services like around-the-clock customer service, in-network preventive care, and dedicated healthcare specialists, tools that let you compare doctors, facilities, even procedures. Example, make sure you have access to quality doctors and hospitals close to your home. Our online provider directory not only shows you if your doctor is in-network, but includes patient reviews and doctor quality scores. Cut down on unnecessary trips to the ER.
Yeah, I'm sure you would like that, wouldn't you?
And finally, Cigna's tools guide you to plans with deductibles, benefits, and features that match.
Look at this. Oh my God. Look at how just like convoluted this is. A $10,000 deductible for a family. This is why people aren't going to the doctor. Jeez, look at these freaking deductibles. Oh my God. That's the type of plan, the type of choice that you'll get whenever you have insurance just to have it, but you're never going to actually use it.
An HMO network is a group of specialists and primary care physicians that we contract with at Blue Care Network. It also includes hospitals and other healthcare providers.
Cool.
And as a member of Blue Care Network, you have to select a primary care physician and stay within the network of providers.
Right, you gotta stay in that network.
That way you don't get hit with any out-of-network bills.
Yeah.
Now, Blue Care Network
That would
has
suck.
so when going on, it's a very good chance that you'll find your doctor.
Very good chance. I hope. Fingers crossed. There's a lot of misconceptions about Medicaid. Some people think that it's strictly income-based, that if you make below a certain amount that you'll be covered. That is not true. You have to have a qualifier. And every state is different. I live in Florida. We're right under Alabama. Basically, what Alabama craps out, that's where I am. If you live in Alabama, good luck. I get a patient that's from Alabama, I pretty much know they're going to be stuck with that bill. There's not going to be anything I can do for them. The employer thing is kind of interesting. It's a uniquely American thing. If you're working a job full-time and you have Blue Cross or Cigna or United Healthcare or whatever, and you get sick enough or injured enough, you're going to have to go on either FMLA or some type of temporary, possibly permanent job loss. If you're no longer working, guess what? You're no longer paying for your health insurance. So you're going to lose it. A lot of health insurance companies are banking on that because they know that your coverage is tied to your employer. Now, they do give you an option, like through Cobra or something. which it's named after a snake for a reason, which most people would never be able to afford. And so if you do have something catastrophic happen, you likely won't be able to meet your deductible of $4,000, $6,000, $8,000, $10,000 out of pocket. And then you're going to stop paying for your health insurance because you don't have any income. So the health insurance company, they're off the hook, and you're stuck with your $100,000, $200,000, $300,000 bill. And you just hope that I can come in and do something for you.
They're crying out for help, as are Americans all over the country. They're saying, you know, we heard from politicians that we love our private health insurance companies. That's not true.
I have never in my life had anybody be like, oh, I love my health insurance company. You're gonna find out with the coronavirus stuff just how much you love your health insurance company. Oh, this is a huge thing, guys. I wanna share this with you. This is so important that nobody talks about. A GoFundMe page. Guys, if you set up a GoFundMe page, do not put it in the name of the patient or your friend or whoever it is that you're trying to get it for. Put it in somebody else's name that is not at all related to that patient. Because what you're going to do is, if you're successful and you raise $10,000 for your family member or whoever, and you put that in their name, you're going to boost up their assets, which means that if they might have qualified for disability or some long-term care that they may have needed, they no longer qualify for it. This has happened several times where I will have a patient that their heart functions at 10% capacity. They probably won't live for, you know, another 6 to 8 months. Let me try and get you on disability. That way you'll have some type of income and we'll be able to get you Medicaid for that. So all your hospital stuff, prescriptions, we'll be able to get that covered. But some well-intentioned family member starts a GoFundMe for them, puts them over assets. They no longer qualify for that. Please be careful with that. That's all I wanted to talk about today, everyone. I know that wasn't a very fun one, I guess, but it's important to talk about. We've got the coronavirus right now. A lot of people are going to be seeking medical help. I have volunteered at the hospital, so they're going to be training me to deal with some other stuff that I've never done before. Mostly because while all the kids are out of school, there are a lot of nurses and techs and even doctors that are going to have to take time off to take care of their kids. Well, I have no one. So I might be working some extended hour shifts at the hospital. And I have run into patients that watch me on YouTube. So if you see me, it's a good thing. I usually can do a lot of good for people. I know that this is a complicated thing. I know people have a lot of strong feelings, political and otherwise, about this. Let me know what you think in the comments below. Keep it civil. We can have a grown-up conversation about this. If you have any questions for me and about what I do, I'd be glad to talk about it. This would be like the perfect time to get into that. A lot of my knowledge is based around Florida and Alabama because that's where I live, but in every state, Medicaid specifically has different requirements, different rules. I hate to tell you which way to vote, but if your state is trying to expand Medicaid, just do your neighbor a favor and vote to expand. But that's it for me, guys. Leave me a like if you enjoyed this video. Subscribe if you want to talk about probably not a whole lot more stuff like this, but subscribe anyway because, you know, I know you'll do the right thing. As always, I appreciate you watching, and I'll catch you in my next video. Take care.